Hi, my name is Ashley Reyes, and I'll be doing my disorder video on compulsive disorder, also known as OCD. So, what is OCD? It is an anxiety disorder that is affecting 2% of our population. This disorder is broken into two parts. The first part is obsessions. They're unwanted, disturbing, and intrusive thoughts or images that are generally seen by the patient as excessive and irrational. The second part would be compulsions. They are repetitive behaviors and mental acts that neutralize obsessions and reduce emotional distress. These obsessions and compulsions are very time consuming. They take up to 1 hour per day for the patient. Whether it's psychological or psychiatric, I found out that it's both. I just figured that it was only psychological in the mind, a stronghold in the mind, but I did find psychiatric treatments. So, despite the abundant research being carried out with OCD, there's no exact cause that can be identified. Abnormalities or an imbalance in the neurotransmitter or brain chemical or serotonin could be to blame. The OCD can be triggered by a combination of genetic, neurological, behavior, cognitive, and environmental factors. Also, if a parent or family member suffers with this disorder, it can increase your risk at developing OCD. Whether this disorder affects a patient's reality, I believe it affects it a lot. This disorder, in many ways, affects it. They do have repetitive behaviors in response of feeling uncomfortable. So they do all these things because they feel comfortable in the situation that they're in. And that's all in their mind, but feeling uncomfortable isn't normal. So if that's a reality, then it's not a normal reality, or it's not a pleasing reality. There is a branch of OCD that is for hoarders, people who hoard too much, either in their house or job or whatever. Their reality can be shifted because if they're hoarding too much, too many things in their house, that could be normal to them. It's their reality. But in our reality, it could be harmful for them to have everything in their house cluttered. Having OCD, the patients have described it as paralyzing and unending anxiety. Imagine having that. That wouldn't be normal, and that wouldn't be a pleasing reality. It's not normal to be in fear at all times. These patients are constantly in fear, feeling that anxiety is not, and not being able to change it if there is no treatment being held. With this disorder, it is a mindset, I believe. So the only spiritual aspect to this is that it's a stronghold to your mind. With the spiritual aspect, I think it could only be diagnosed if it hinders your faith with God, with the wrongful thoughts or images. I think that's the only way that it could be diagnosed, if you were able to pick up on that. It's not like the OCD is taking over someone's body completely to where they can't control their movement, or their mind is being taken over. So I don't think it could be spiritually diagnosed. There are common symptoms with this disorder. First is the obsessions, the fear of contaminations, thought of doubt, fear of harming self or others, and the need of exactness. The compulsions are the washing and cleaning, checking, ordering, arranging, mental rituals, and hoarding. The treatments that can be held are, I found 2 treatments that could happen. There is behavioral therapy, which is increasing the exposure to what causes the problem, but not allowing the compulsive behavior to occur. A second treatment that could happen with a patient is what's known as the SSRI, also known as selective serotonin reuptake inhibitor. Basically, it's prescription drugs. The most common is an antidepressant. They're more effective than the placebo treatment. The MRI has 25% or more reduction in symptoms. They say the sooner you see the symptoms and are diagnosed with it, the sooner or the better the outcome. Christian counseling with OCD, I found many things on the internet offering Christian counseling, Christian therapy, also many books on therapy and faith-based help. But I also found a website that linked me to a hospital that had specifically a treatment for OCD. Then this hospital called their treatment the renewal treatment. It's a Christian faith-based treatment. They offer many things to help a patient with OCD overcome it. They offer daily devotional and chapel services, evening Bible studies, Christian counseling, devotional and prayer time, topical Bible study, pastoral guidance, and weekend worship services. So this website did offer a lot to a patient with a faith-based core. And so, of course, I always believe that going with God would be the best treatment. He doesn't want any of us to have the spirit of fear. He wants us to have a sound mind. So, of course, I know that Jesus could heal anybody with the disorder of OCD. Thank you.